It's my feel-good breakfast show.
Now let's focus on health matters, and I would imagine for the right family, vitally important information. Living with ADHD can be challenging. However, with the proper support and treatment, individuals with ADHD can learn to manage their symptoms and lead very successful lives. And joining us this morning on behalf of ACINO PHARMA is psychiatrist Professor Renata Skuman, who will be educating us a little bit more about ADHD. It is a difficult thing to compartmentalize because there are so many different symptoms that can be attached to it, not all of them meaning that your child has ADHD. Can you sum up what attention deficit disorder is for us?
So I'm always scared of calling it a label, and I would advise against it, but I think it is important that you know what the diagnosis entails. So ADHD is a neurodevelopmental disorder, which means there's genetic factors contributing and then other risk factors. And then the symptoms is present really from very early in life. And there's a cluster of symptoms we look out for: inattentiveness, that can portray in different ways, impulsivity, hyperactivity, and that has to be present in different areas. It's not only at school. It must be developmentally inappropriate, and it must cause functional impairment. And functional impairment also refers to social difficulties or social impairment. Not all kids have academic impairment, or not all adults have occupational impairment, but there might be interpersonal difficulties that they can have. One of the things that's not part of the core diagnostic criteria, but which is very common and also create difficulties, is what we call emotional dysregulation. Now, in children, it can be manifested as maybe a bit more frequent meltdowns, more moodiness. In adults as well, up and downs in moods in one day. It's not an episodic thing. And then also more temper tantrums, speeding. So there's all kinds of things that we can see then in adults that's also playing a role.
How do you go about identifying and then going through that process and then starting a treatment plan?
So the one thing you can't do is buy a rating scale. It's not a tick-box exercise that you download from the internet. Tick, tick,
That's
tick,
why
tick.
we move away from labels.
Yes, it is not a child that's just naughty or lazy or very busy. And then it's really necessary to do a comprehensive assessment, which we call a comprehensive diagnostic interview, which is a long consultation, but also collateral information from teachers, from parents, from employers.
That's the whole ecosystem you really need to
Yes, and we also need to make sure that we exclude other things that can mimic the symptoms of ADHD. And two of the most common things these days is excessive screen time and sleep deprivation.
When we talk about comorbidities, obviously during our COVID journey, that was a term that was bandied about a lot. How does it apply in this sense? What are some of the comorbidities associated with ADHD?
So an individual with ADHD, whether it's a child, a teenager or an adult, have difficulties, and life is just in general a bit more challenging. So for example, they might struggle at school, either academically or socially, and then become excluded, self-esteem drop, and we end up with depression or anxiety. Now that depression or anxiety is what we call a comorbid disorder.
Right.
But comorbid disorders in general are very common in ADHD, with up to 87% of individuals with untreated ADHD presenting then with comorbidity, either anxiety, depression, sleep disorders, adjustment disorders, substance abuse. And that just means you're less resilient. And then some, up to 57%, which is still almost two-thirds, have more than one comorbid disorder.
I can feel my son saying, "Thanks, Dad. Thanks for this one." But then how do we go about treating through the various phases of life?
So very first thing is, once again, you need to make sure about the diagnosis. If symptoms are only there between Monday and Friday or during the exam period, it's most likely not ADHD. That's something that maybe need a bit more discipline, planning, organization.
For sure, there's a structural issue there, yeah.
Medication. Also, when we look at the diagnosis, if the symptoms is mild, you don't need medication. It's moderate or severe symptoms that need medication. But it doesn't matter what you do, it needs to be what we call multidisciplinary intervention, and it needs to be a holistic approach. That means medication have a place, therapy helping with social skills, with executive function, that's the ability to plan and to organize, and also other type of therapies, parenting skills are crucial. And then also lifestyle interventions, sleep, exercise daily preferably, and then also limiting the screen time.
Game changer for me in my journey with my mom, who fought this battle for many years. introducing me into martial arts, giving me more tools to be able to regulate my own emotions was a massive part of that. I know that medication in this space can have side effects. How do you manage that portion of the journey?
So I think it's very important that over the past 2-3 years, there's alternative treatments available in South Africa. Until a couple of years ago, there was only the ones that everyone knows.
Yeah, for sure.
Yeah, and now we have the ability to tailor-make either medication that differ in duration or they differ in side effect profile. But we now have different groups of medication. And if people develop side effects, it's important to discuss it with your healthcare provider, with your psychiatrist or your pediatrician. And it's often dose-related side effects, or you can change between the one group and the other. So it's important that we really must look at the individual and what is needed for that specific person in their specific day and context.
Prof, you talk about different groups of medication. Can you expand on that?
Yes, so in South Africa, we have 2 groups. So you have the stimulants, the ones that was traditionally available in South Africa that everyone know, and then the non-stimulants. So we position them a bit differently. Maybe if you have more anxiety, maybe if you're a bit older or you need a longer duration of action. And in the stimulants, we also have 2 groups. So there's the methylphenidate group, the ones that's very popular historically as well. And then we have a newer group on the market, the amphetamine group, with lisdexamfetamine and amphetamine. So all of these have different durations of actions, different side effects profiles, and that's why it really opens the door for us to tailor-made treatment. And it's so important that people often get medication and they don't follow up, and then they experience side effects. And as I said, maybe we could just drop the dose, because medication should never change your personality or your creativity. We don't want dull people or dull kids. We want people that can really reach the full of their potential and have a joyous, fruitful life, that they're really optimal human beings.
And feel like they have some control.
Yeah.
And it's there. And we've got an amazing support structure around us. You are so the right person to bring in for this. Thank you so, so much. This has been a little bit self-indulgent, but thank you. I have no doubt that there are a lot of parents out there who have suddenly woken up. So thank you so, so much. Not everyone sees ADHD, but everyone can see potential, and getting the correct treatment for ADHD can help you reach your potential. So please, I urge you to go and visit adhd-institute.com for a wealth of information on the treatment and management of ADHD.